The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of hair transplant surgery, hair restoration, men and women. In fact, more and more women are going in for these procedures and getting great results. Well, with us, we have an authority on the topic, an expert, Dr. Pistone. Dr. Pistone, welcome to the program.
Thanks, Randy. Nice to be here.
All right, now, we should mention, that in Jersey and Philly and New York, that you are the brand name for hair restoration.
Well, we've been there a long time.
Okay.
I grew up in Philly, South Philadelphia to be specific, Little Italy.
Is there a difference, by the way, South Philly and
South Philly's Little Italy.
Okay.
Think Rocky.
Okay.
Think Rocky Balboa.
Okay.
So yes, we've been there forever. My family's been there for several generations, and my practice has been there since the day I hung out a shingle in 1984.
You have a regular dermatology practice, but all you do is the hair part. I mean, who's the typical patient that you see?
99% of what I do is hair.
Okay.
Yes, I do have a dermatology practice. I have dermatologists that work for me. I have estheticians, but I spend every day, all day, doing hair transplantation.
Now, what are the age ranges, by the way, of the men that are coming in for hair?
The range really is from 18 to 90.
What's your oldest patient, by the way?
My oldest patient's 88 years old.
Is that right?
Yeah, she was an 88-year-old woman who was still active, still working.
What about the men? What are the higher ranges of men coming in?
I have men in their 80s.
All the time,
all the time.
Really?
Now,
could you make a big difference, though, when somebody's 80 years old?
It makes a difference to them because they're dating, and they're very, very active, they're very healthy, so why not?
Okay.
You want to look good at any age.
Okay, now your background, and by the way, you draw from what? You draw from Philadelphia, New Jersey. Where else do people come to see you?
We really draw from the world. Most of our patients come from the Delaware Valley, the East Coast, but we have patients from as far as Norway, Africa, Ireland, Italy, France. I was very surprised to see the patient from Norway this year who actually flew in for a consultation, flew back, then flew back for a surgery, and didn't even want to see the Liberty Bell.
Okay. I just want to see Dr. Pistone. Now, you're known for natural results. I mean, is there that much art to this, by the way? And I don't say that as, to downplay this, but is there really a lot of
Well, you have
art?
to have a basic technical skill, but it's mostly art.
Really?
It's mostly art. I look at my patients, I have a blank canvas, and I'm Picasso.
Okay. You say that to them?
I do say that to them, and that's how I feel.
Okay.
So when people ask me, doesn't this get tedious? Isn't this boring? No, because I tell my patients, you're my canvas for today, and I have my paints, just like any painter has his paints.
Okay.
But we're gonna paint another different Picasso for you today.
Now, like an artist, do you see the end result in mind?
I see it
when
in
you
my
look at the
eye.
patient, you know it?
When I draw a hairline, which is the most important part of the procedure,
Okay.
I see it. I see it in my eye. Now, you read a book on hair transplantation for beginners, and there are parameters that we use based on different systems. We can use the Michelangelo rule of thirds. We can use different facial structures to draw lines. But I can see what that patient's going to look like when that hair is grown in before I even put a mark on them.
All right. Now, we should mention also, you teach other doctors the procedure. You are a university professor, I guess, at the most prestigious medical schools, top medical schools in Philadelphia.
Well, Philadelphia is known for its good medical schools. I have the privilege to be on the faculty of 2 of them. I used to teach medical students, but now I teach residents who really do not get this training in their residency.
Hair transplant.
Hair transplant is very unusual.
And what do you call it, by the way? I mean, in your lingo, do you guys call it restoration, hair transplant surgery?
Well, hair restoration encompasses the entire field.
Okay.
That is, it could be medical. It doesn't have to be surgical.
Like alopecia, things like that?
For someone who's just starting to lose their hair, for example,
Okay.
we may not need a surgical intervention. We may approach with a medical intervention, such as minoxidil or finasteride, especially in a younger patient. But so that's hair restoration. But when we decide surgery is necessary or desired, then it's hair transplantation. That's the technique we use. But we use a whole palette of techniques.
Now, you've done about 16,000 cases.
Yes, I've done about 15,000 plus. I stopped counting at 15,000.
All right.
I thought that was sufficient.
Are you that much better now? I mean, is this one of those things that there's a big learning curve? I mean, are you that much better at creating a natural hairline than you were 10,000 cases ago?
Yes. I think, first of all, you need an innate talent to do it. You need an innate creative talent. So you'll find a lot of hair transplant surgeons do a lot of other things. For example, I'm a drummer. I work with my hands, and so I think this came natural to me. And it's something you can't learn. If you don't have the talent, you can never learn how to do an artful transplant. You can do a good technical transplant, but it's the artful transplant that separates the great hair transplants from the average transplants. But I've heard people who take it not seriously. Surgeons who are good surgeons, they may be plastic surgeons or general surgeons, they say, if I can take an appendix out, I can do a hair transplant. No, that's not the case.
They say things like that?
They do say things, and so they already have missed the point. Hair transplant isn't about taking out an organ. It's about a fine detail to the skin and the scalp and the angle of the hair. And it's not all about taking something out and stitching it back together as quickly as possible before the anesthesia wears off. It's delicate work.
Why do you like it so much? I mean, when did you know you wanted to do this, by the way?
I always liked it. I always liked it since the first time I saw it, and that's going back pre-1990. But the techniques back then were not refined enough for me. That was the days of the old plug techniques.
Okay.
And there's no way I would do that to someone. And I joke with my patients, because they ask me, why did you go into this field? And I tell them, well, my one grandfather was a barber, and my uncle, and my other grandfather was a blueberry farmer. So therefore, I like to grow hair. I like to grow things. And maybe it's true, but the truth is, I don't know why I like it. I took a liking to it, and I started to do it, and I became very good at it. And I started to love it, but then I really started to love it when I found out that you not only do it, you make people happy.
You say to people, I mean, there's a lot of people really hung up, a lot of men, that their receding hairline drives them crazy, or holds them back in life.
That's another thing about this field that I wasn't aware of when I went into it. I went into it as a technical, interesting procedure for myself. What I discovered when I got into it was that men are devastated by it sometimes. Not all men. Some men are very comfortable with a bald head or a shaved head, but they're not the men that come to see me. And I applaud them, and they're okay. I'm not trying to convert the world. Okay. But the men that come to see me obviously have a concern. And they're wearing hats all their lives. They're shy. They're withdrawn. They don't go out. They don't have a girlfriend. They don't have the confidence they used to have. This is my average patient.
Makes you look older too, by the way, when you have a receding hair. No doubt about it.
I've done a reverse technique on myself. I've removed all my hair.
Okay.
On camera. Okay. And I look horrible. And I would never let myself go bald. Never.
Okay.
So yeah, it makes you look older. When I do a transplant, it takes anywhere from 5 to 10 years off your age. And the nice thing about it is most people notice it, that you look better, and they'll ask you, did you shave? Did you lose weight? Are you working out? But they'll never say, I like your hair transplant. Yeah. Not with today's techniques, performed properly and artfully.
It's become mainstream, you say.
It's now mainstream, yes. It's now mainstream.
I mean, hundreds of thousands of people are doing this monthly throughout the U.S.
Absolutely, and the numbers have been increasing. My range of patients range from farmers to rabbis to priests. I mean, one of my oldest patients was an 85-year-old priest. So in between, you see everyone, CEOs, lawyers, malpractice attorneys, who I like to kid around with.
What's their main motivation, by the way? Is it attracting a mate? Is it they want to look younger? I mean, what's their motivation?
It depends on the patient, but
Okay.
I think if you had to distill it down to one motivation, it's confidence.
Okay.
So you could be young and you're not able to get dates because you don't have hair, or you lack the confidence of not having hair, and that's one motivation in that age group. You could be a middle manager in a CEO in a company in an economy in recession, and you want to keep your job and you want to be competitive against those younger guys. This is what people tell me. You could be a millionaire.
Okay.
And you could have everything you want except a youthful appearance. And you're young and you're vigorous and you still want to live life, but your hair isn't there anymore. So you're going to spend that money on your hair, and it's money well spent. And these guys, to my surprise, the most successful guys, the most macho guys,
Okay.
I was shocked the first time one of them came to me at the end of the year, which we give it a year to grow in. He pardoned himself, and then he hugged me in a bear hug, started to cry because he was a big truck driver. He started to cry and said,
Really?
"Dr. Pistone, you changed my life."
Is that right?
Yes.
I mean, you see transformations where you know, because I see these commercials where the guys are running and hiking and canoeing, and their whole life changes because they have their hair. And maybe I'm insensitive to it because, you know, I don't have that issue. But do you see that kind of a thing?
You know what?
Where you see changes?
When I used to see those commercials, I used to think it was nonsense. But I will tell you, this is a life-changing procedure.
Okay. You know, there was a survey, you know, I looked it up on the internet knowing you were coming here, but like 70% of women would prefer to have a man with hair or a thick hairline over a receding. In fact, I did my own little survey amongst my friends. Certain women said, I wouldn't date a guy that's bald. I mean, that's bad to me. But I'm just telling you what I heard.
Well, there are a lot of generalities, and I think they become generalities because they're generally true.
Okay.
One thing women like is tall men.
Okay.
Another thing women like is men with thick, curly hair, in general. Certainly there are women who love short guys, thank God for me.
Okay.
And certainly there are women who like men with shaved heads. But I think in general, especially in the younger years, women like to date men with hair, and young men are especially sensitive to that. When they go to a club or a bar and they're being passed over, and they know it's their hair, and they wear a hat, and it's just devastating to them.
It's like anything else. I mean, if something bothers you, it will hold you back in your life. And it might be just in your head.
If it bothers you, you lose your confidence.
You know,
if you don't have confidence, people sense it. They smell fear.
Okay.
So they smell your lack of confidence.
So as the technology come, I mean, are you that much better as far as creating a natural look? I guess the plug look is behind you. And you fix those people, right? I mean, you also fix people that had some older transplant surgery?
Yeah, a great deal of our work is repair.
Okay.
And fortunately, with today's tools, we can help most of these men and women.
How are you different or better? I'll put you on the spot here. How are you better than some of these chains? I mean, as you said, these chain hair transplant companies. How are you better? Or are you, in your opinion?
I worked for a chain.
Okay.
I know what goes on in chains. I know about chains. Again, you can't generalize, but there are some things that you can generalize. One of the issues I have with a chain is that it's usually all about the money. You have to sit there in the chair. You have a salesman who sometimes acts like a car salesman, and these are things that my patients tell me.
They tell you that, okay.
Yeah, that they've been just treated. We have a CEO or a senior malpractice attorney going into an office that looks very beautiful, and they're being pressured to buy a hair transplant.
By a salesman?
By a young car salesman.
Okay.
And they're being offered 500 grafts, extra free grafts to sign up that night.
If they do it today.
Now, and
does that really go on?
It goes on.
Incredible.
It goes on. It goes on right now.
Okay. So enough about that, but how are you better in your opinion, or how are you different?
Well, my name's on the door.
Okay.
And this is what I tell my patients. I've been here 20 years. My name's on the door. I've done 15,000 hair transplants. People know where to find me. I'm still here.
Okay.
You look at my record, I don't have a lawsuit for a hair transplant failure. I've never seen a hair transplant not grow in my hands. We do 1 at most 2 hair transplants a day.
Okay.
Chains and so other clinics, they do 4 patients at the same time, so it's an assembly line approach.
All right, now your work. You're very proud of this work.
Yes.
Let's take a look.
Let me just show you.
Is this a typical patient that you see?
Yeah, this is one of my typical patients. He's in his 30s. He hasn't lost all his hair, but he's on his way, and he's very apparently going bald. Typical patient was interfering with his social life. He just had broken up with his girlfriend, wanted to get back out there and meet someone.
And do they tell you this on the consult?
Absolutely, they tell me everything.
You look at this guy, you say, okay, boy, this is going to be good.
Yeah, I can see it. You can see the hairline there that I sketched in, and then you can see the results.
Very nice, very natural. Now look, I feel like, my son and I, we have a joke where we could spot a good hair transplant a mile away,
that we don't want to hear.
But this hairline is good. I mean, is that really in the hands of the surgeon, or the hands of the guy that's doing the procedure?
It's entirely in the hands of the guy, the procedure.
Okay.
Yeah, because otherwise you can see little rows of hairs.
Do you still see that even today?
Absolutely. Now you see the last guy, mostly we focused on his hairline and frontal area of the scalp. Here's a guy that's losing his hair from the back forward.
Is that common, by the way?
No, it's not as common. Usually you go from the front backwards, but you could certainly go from the back forwards.
Do they come in and think, Doc, am I too far gone? Am I a good candidate? I mean, they come in thinking there's not much could be done?
Well, it's surprising that they come in with just a moderate amount of hair loss and they think they're gone. When we, in actuality, have many patients come in that look like Kojak.
Really?
And we can put them back, I mean,
really?
to a full appearing head of hair.
You're a cue ball these days? I mean, you could really give them an appearance of a hairline?
If you're shaving your head and you have hair back here that's thick, I can take this much hair and I can give you a hairline and hair and make you look great.
Okay, good. So with this guy, when you look at this again, easy for you to do.
Yeah, now this guy's losing his hair from the back forward. So his main concern was to graft the back. So you can see the back, and then you can see afterwards we've not only covered the back very nicely, but we've covered the front.
That's a thick head of hair.
So as you can see in the vertex, or the crown of the scalp, the approach is very different. We look at the front hairline, but we also call it a back hairline. So the back hairline is as important as the front hairline. In the back is like the spokes of a wheel with circles in it. It's like a hurricane that you see on television. That's what the back of your head looks like. So we have to be very particular back there. We have to angle the hair properly, and it has to be at all different angles, just like you see in a hurricane when it swirls around the screen.
To get this little swirly look.
To get a natural appearance. So that's the key, that's critical to the crown of the scalp, and that's where artistry comes in. You just can't put all straight grafts in there, and you can't put them all at the same angle.
Now, I'm not in the business, but if other guys in the business see this, do they say that's good work when they see something like this?
Hopefully, if other guys in the business see that, they won't know it's any work at all. And in fact, many of these patients go back to their barbers without having told them. And their barbers don't believe they've had a hair transplant after having them advised not to have one, because barbers remember the old results. And the barbers are shocked. And that's where I pick up an entire new group of patients.
So once the barber sees what you do,
they're shocked.
They say you got to go see Dr. Pistone.
They can't find a scar. They can't find a scar anywhere. They search for it. And they're so amazed. The barbers often come in themselves first, just to be sure. And then...
What do you mean they come in first? They come in to get their...
They come in to get their hair done. Because they think...
You do a lot of barbers?
I do a lot of barbers. And they think back in the old plug pain days, and now the plug pain bleeding days, and now it's the sedation follicular unit fine result days. You should not see a hair transplant. You should not notice a hair transplant. And when you get a hair transplant, no one in your family, and certainly none of your friends, should ever notice you've had it. They will tell you, you look great, you look different, are you working out, did you get glasses, did you take your glasses off, did you grow a mustache, did you shave your mustache?
Okay.
But they will never ask you if you had a hair transplant, if it's properly done and artfully done.
Are you using all the new techniques, by the way?
I'm all about results.
Okay.
And if this ever becomes mainstream, if you can do what I can do, if a machine can do better what I can do,
You'll switch over.
then I'll switch. Until then, come see me.
All right, okay.
Yeah.
What else do you have here? And we have to rush through these a little bit. I'm sorry, but it's interesting stuff.
Yeah, well, this is a patient. Hair transplant's not all about vanity and confidence, although you can see in this gentleman.
What's going on there? Scar tissue of some sort?
He had a severe burn of his face. And if you take a look at it, you can see it's very, very disturbing to him to have to walk around in this way. Some people suffer from scar tissue from various types of trauma. Even scar tissue can be grafted, and
so like facelift scars or
facelift scars,
kind of a burn, I guess.
accident scars, burn scars. They can all be grafted, and you get excellent growth in
So
scars.
you kind of put in a sideburn for this guy.
I put a sideburn in for him.
You could put hair in scar tissue.
You could put hair
burn.
anywhere.
Really?
But it doesn't.
Didn't know that.
In fact, scar tissue has a better vascular supply
Is that right?
than regular tissue. So hair always grows in scar tissue, and we get excellent results with scar
Let's
tissue.
take a look at that guy's after.
As you can see, he has his full sideburn again.
Nice.
And it even helps to cover up his hearing aid, which was very embarrassing to him. And here's another patient, and a friend of mine, who had a very bad plug job, as they call it, back in the old days. And in the past, we were not able to repair these. But with the newer techniques, especially with follicular unit transplantation, we can get him out of a hairpiece and restore his hair as if it was never touched by a plug.
So would you like to see more? I mean, there's probably thousands of people in Philly and in Jersey that have the old procedure, and what, they don't know anything could be done?
I don't think a lot of men are aware that they can actually fix an old procedure, or they've been so traumatized by what happened to them before that they're not willing to do it. But I would just ask them to take a second look these days if they're really troubled by it.
All right, okay. So what else do we have here?
Now I want you to look at this. Now I want you to see the results he has now.
Oh, nice.
He has a full natural head of hair.
Interesting. So side by side, very nice hairline. What does he say when it's all done?
Well, you can see what he says on my website,
Okay.
but there's no words for what he can say. There's no words for what he says. Let me show you this other patient.
Okay.
Not as severe as what you've seen, but he's losing his hair. It's very apparent.
How young are these guys that you're showing me?
This guy is in his 30s.
Okay.
And he's an attorney, so he's very conscious about his courtroom appearance. And with one procedure, this is his results. Everything's filled in very nicely, and he's quite happy with his results.
And how soon can they go back to work? I mean, you know.
You can go back to work in 4 days.
4 days?
If you take a long weekend, you can go back to work on a Monday, Tuesday.
I mean, if you go on a Thursday, back to work on Monday.
Yes, you can do that. That's very, very common, very typical.
Okay.
Yes.
Okay.
And again, this is another typical patient who's losing his hair from the front.
There's a lot of hair loss.
A lot of hair loss, in his 20s, wears a hat all the time. And as you can see, one procedure, we filled this in very nicely for him, and he's not wearing a hat anymore.
So is there attitude changes, you think? That's what makes him more attractive?
That's it.
Because obviously it's not just the hair.
That's it, because people think it's a superficial. People think this is vain and superficial. You know what? It is.
Okay.
But it's not, because if it gave you more confidence, if it can make you feel that confidence, the confidence makes a difference. People sense it. They sense when you walk into a room and you're confident. They sense when you walk into a room and you know who you are and you can take control of that situation. If you're a man, women sense it right away. They can smell it.
Okay. All right. So that happens for a lot of these guys.
It happens for most of these guys.
Is that why you like this, though?
I like it because I make people happy. Every patient is a new painting, and every painting makes me happy when they're happy. So that's my goal in life, to make them happy.
Okay. You know what I like about you? You know, we were talking on the phone, and I was talking to some of my friends, and I said, you know, I was talking behind your back, and I was saying, you know, this guy says he searched the world to learn the best hair transplant techniques. Is that right?
That's true. Back when I learned it, there's no transplant school.
I mean, where'd you go to learn some of these techniques?
I went all over the world to learn it. The first person I went to was literally the doctor that wrote the book on hair transplants.
You had to meet this guy.
He was in Oklahoma, but he wrote the book, and and the classification system is named after him. That's the first place I went. Second place I went was Greece, because I was allowed to operate on patients in Greece, and you can't operate on patients in the United States while you're learning. So I took that opportunity. But I've traveled all over the world. I've learned different techniques from different mentors, and I've blended them into my own technique. I have the Pistone technique now, I call it. And it's just the results of many different doctors who's worked on this for years and years of their lives.
And there is art to this. I mean, this is 90% art?
It's 90% art, yes.
Is that right?
Yes.
And are you one of these guys that thinks that, you know, you're about as good as it gets? I mean, you know, not something you say to patients, but do you feel that way?
Well, you know, I'm a modest guy. I mean, I was taught to be modest.
But do you feel like that in your head?
I grew up modestly, but frankly, when my patients look me in the eye and they tell me, "Are you the best?" I tell them, "I'm the best."
Well,
and I know it sounds a little immodest, but you know what? When I'm going in for surgery, I want my surgeon to say, "I'm the best."
Final message. We're out of time. A man watching this, not happy with their hairline. Maybe they've had even the old plug procedure, but they're miserable because of their hair. What do you say to them? Okay.
Come in for a consultation. We don't charge. It's free. What do you have to lose?
For the consultation. Good.
What do you have to lose?
Nothing to lose. All right. Well, thank you so much for coming.
Thank you,
Very
Randy.
interesting. Good stuff.
Thank
really
you.
Good. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com and put in Dr. Pistone or hair transplant surgery or hair restoration. You'll be able to find it there. For now, I wish you good health.